Hi everyone, my name is Dr. Niran and I'm a dentist in Dentgroup. I will tell you today more about the dental implants. What are they? Why do we do it? And what are the risk factors for getting an implant? So let's get into it. Implant, in a term of understanding, is actually replacing an organ. Like we have a hip implants, right? When we have a broken bone, we put the implant in anywhere in the body and we try to get a new life with it. In the dental perspective, the organ is our teeth. So we have a function with them, we chew with them. If we lose a teeth, then we want to keep the function going on. We want to put a new organ, meaning implant. We try to replace the tooth itself, so we try to create an organ that looks like a teeth, like a root itself. And then we try to put on the prosthetic part on top of it and make you chew again. Is this the only way? You can ask. Sometimes yes, sometimes no. Is this the first thing we should think of? Yes. Because the other ways usually consist of using the other tissues. We have to make some support. It's rather in the next tooth itself or the soft tissue itself, but we have to take the support from somewhere. So we try and we want to get the support in the part that is lost already. And if you're suitable for the operation, then we tell you the risks and we tell you the benefits and we try to decide together. So every patient is different. There is no one right way, but we can say as a concept, we want to preserve the tissue itself. What I mean by preserving the tissue is our teeth are in the bone. So when we extract the teeth, the bone surrounding the teeth is going to disappear because they're communicating. They're talking to each other. And the bone says, oh my God, teeth is gone. Let's get out of here. And then the bone collapses. But it's not just the bone. If the bone is going down, the soft tissue is also going down. And then this creates whole systematic problems for the chewing system. What we want to do is we put the implant in as soon as possible, so we keep the bone around there healthy as possible, and the soft tissue as well. So if this implant is that good, then why some people can't have it? Let's talk about the risk factors. So the most dangerous risk factor is chemo and radiotherapy. The patients that had cancer before, because radiotherapy and chemotherapy is altering the tissues altogether. So it's very risky for them. There should be a time passing after the treatment and the tissues gets itself together when they are ready to reconstruct as a body, as a healthy tissue, then we can put the implant in. The other part is patients that uses bisphosphonate medication. Yes. And we use this medication for osteoporosis. Usually women older than 40, now it's gone down to 40, unfortunately, use bisphosphonate very often. So we have to ask our patients, do you use this medication? The other part is using cigarettes, smoking. The smoking is putting pressure on blood vessels and actually making blood cells going to the area that we did the implant in and making healing a lot slower and doing peri-implantitis. So we don't like it, like at all. If you use smoke, if you're smoking, you still can have the implant, but there's a risk factor around it. High blood pressure. The other part is SSRI using. The other part is proton inhibitors for the stomach. These all are risk factors. What we want to do is we want to eliminate your problems and we want to create the best solution. So you must see a dentist, a doctor, or surgeon for your planning, treatment planning. It's very important. In basic terms, dental implants are kind of a must in some cases. We talk about this so much because there are a lot of different and wrong informations out there. We use biocompatible materials. The implants are in the business for more than 80 years now. They always go round and round and try to make a better one for humans. It is not a like an aesthetic treatment. It is a functional treatment. We want you to continue chewing. We want to preserve the system. So we know, all of the dentistry knows that there are risk factors, so we should eliminate the factors for you, like a very personal planning. For that, you should see your doctor. And if there is anything you want to ask, you can always contact us. Bye! Dentgroup.